My name is Parveen Boertje and I'm the Chief Customer Officer.
My name is Elton Felisie and I'm the Chief Financial Officer.
My name is Reginald Willemsberg and I'm the Chief Operations Officer.
What SZV means to me, SZV, I have a good relationship in the sense of it helps me develop myself professionally to the best ability that I have. And at the same time, what I feel working at SZV is I'm helping the community, especially from a social security perspective, be a better community. So it's, I would say, a symbiotic relationship by which I get my benefit, but the community as a whole also from the labor that I put in also gets benefit from it.
Yeah, I agree with what you say, Elton. And for me, the word responsibility comes in mind. You have responsibilities towards the community, like you say, but also towards our colleagues, towards the country. I mean, you can make it as big as you want, but responsibility and pride. Yeah,
Yes.
I'm proud to be working for SZV.
Yes.
Well, I agree with the point of departures that you brought up, and I see SZV as a family, an organization as family, and as a family, you have a father, you have a mother, and you're taking care of the family being in general the population of St. Maarten, those insured, based on the principles of the Social Security, which the point of departure is that we take care of those who cannot take care of themselves.
Yeah.
Yeah.
And for me, that is it's basically what has me, that what I get up for every day when I wake up, that is what I'm looking forward to. The passion that we have, and I think I see that a lot in our colleagues, that are not only on management level, but also at the lower echelons, that you see that as a family, we all are looking out for each other to take care of the community. Well, I can go back from the time we started in 2000, after 10-10-10, and you remember at that time, the then Minister of VSA, Minister Boncamper at that time, we had a conversation and said, listen, we need to do something about the lines that people are waiting outside from 5 o'clock in the morning. And we went to the drawing board and we came up with a solution. And the solution was, let's start working with appointments. I think SZV was a leader when it comes to that. And because after that, we see other organizations that start using that. And by doing that, we alleviated the burden that people had. People had to come every morning to fight for, to get a number. And there's so many numbers it was given that day, and then to still wait hours to get a chance to get your business done. Now, by going over to the appointment system, and through the years, how we've improved the appointment system, that I think was the first thing that we did that was different than before 10-10-10. And yeah, that's the biggest one that I could come to mind right now, that had an immediate impact, that people could see, hey, we see a difference between SVB before 10-10-10 and SZV after 10-10-10.
It's such a coincidence that Willemsberg is saying this, because we haven't spoken to each other in preparation of this interview. But when I was thinking about, what is the biggest achievement, the things that makes me proud, I also came up with our efforts in reducing waiting times. Because like you said, after 10-10-10, improvements were made, but we are not there as yet. And one of the things that I look back at as a highlight is the further implementation of the appointment system. And one of our most commonly used services is the renewals of an insurance status. And we introduced appointments for that as well. And we even went a step further by having those appointments to be made online. So that comes to my mind as well, and I think that illustrates the fact that we're not there as yet, but every time we are making that progress. Yeah.
Yes, that's correct, indeed. And from my perspective, being also responsible for IT within SZV, I think we make tremendous steps with implementing a couple of portals. The first one that we implemented is the healthcare portals, by which healthcare providers could have reached us via electronic means, and that would have facilitated a lot of things for them, including declarations. They can see the status of where we're processing the declarations, etc., etc. Thereafter, shortly, we started, I myself together with Parveen, the employers portal for employers to be able to go on the portal and make their declarations. And as you know, in the COVID period that we're in, we took the decision that let's expand it further, by which together with Parveen also we start doing what a lot of clients were requesting. Can we do employees mutations online? Which we did.
Do
Yes.
you remember, because I was then the department head of levy and collection.
Yes.
Do you remember when we first launched the employers portal?
Yes, I remember.
Yeah, it was 2016.
It was
It's
actually
like
in the same room. Actually, we launched it, and
Yes.
yes, it was a success. And our other child is coming, which is for the insured.
Yeah.
And I think Parveen can talk a little bit more about it, what the
Yeah.
plans are. But we started also my SSV
Yeah.
for the insured, and hopefully that would be a very successful endeavor that we're going into.
Yeah, we've come a long way. And talking about, like, when I look at one of the departments that falls on operations, I'm looking at medical referrals. I remember that before SZV, we could have only sent persons to medical treatment in Curaçao. If before that, if you had to go somewhere else, the government, and then the island government of St. Maarten had to deal. But that's one of the first things that we changed also. The second thing then, we changed that we went to look to see where we could send patients. Of course, when we took over, we had no idea where to send people. So it was a learning process and a project that we're not only talking about medical referral, because there's more behind it than just sending people somewhere. You have to go to the countries that we are going to, San Domingo, Colombia, Cayman Islands, wherever you've gone, we went to check them out and to see the quality of the care, logistics, hotels, all of those things, because all of those things were not regulated before 10. Then we had to do it, and then you have to have contracts. So the care procurement, as small as the department is, that had a very important impact, because at the end of the day, it has an impact on the clients that we have to send them.
Exactly.
A lot of people don't know what all goes behind this. They're like, no, it's just get a ticket and go, and that's it. No, it takes a lot, and you have to evaluate a lot of things.
Yeah, and it's good that you say that a lot of people don't know what, because that's for me also one of the achievements from the last 10 years. We are on that path of providing more information to the external world,
Yes.
to our insured, to our employers, to our healthcare providers. The fact that we have a communication, customer care department, like people who are readily available to interact with a variety of customers, that is already in development from the last 10 years as well.
Yes, and I recall when we were started in 2014, one of our first projects were basically help the department automate medical referral, because we were getting complaints from the clients. And what we thought is, okay, let's see how we can automate, and basically on the long run it would benefit the client. And I remember very well how we used to give the clients a check at the process, and we were getting a lot of complaints about the checks. And then once we automate, it went over from check to online payments. So every client has to give their account number, etc., etc. And after that, the complaints, of course, were less, because we remember on Fridays people had to go abroad and come here and ask for a check and hurry up, rush by the bank and get the money, etc. So all those things, we went through. We improve, and the client is the ultimate beneficiary for the improvements that we make.
In my words, I wouldn't like to pick a specific service. I would like to describe it more as a delivery, like fast delivery. That's what they want. They have a question, they have an inquiry, and they need an answer, or they need guidance, or they need a solution. And they need to have that in a reasonable time frame. So for me, what the client would like from SZV, we can look at it at service levels, but we can also look at it as like a criterion that we want to perform at, a performance criterion. And for me, that would be speed. We have to pick up our speed.
Yes, the response time. That's something, if you didn't say it, I would have brought it up.
Okay.
So, great minds think alike. One other thing, I think, as we have embarked on the automation project, you notice that people are, as soon as you have a new product and available digitally, already they start. You just introduce it, and already they start asking for more things.
Yeah, there's a
so I can imagine when you explain. Let's say I remember when you was talking about the mutations, online mutations. As soon as you started with online mutations, the next question, okay, when can I check more information about what's happening? Not just submitting the mutation, but checking information to see if my information is up to date.
To give an example, a cash receipt, the receipt for the payments.
Yes,
that's also a new service that we give via the portal. Due to the fact, especially during COVID, we getting a lot of requests via emails. Can I get a receipt, etc., etc. So we make sure that you will get your receipt via the employer's portal also. Once you do the payments online, or you drop a check by us at the office.
This is indeed a good point, because for as long as I work at SZV, the request and the need for a digital receipt was there, but we took our time.
Yes.
But perhaps, Elton, maybe you can share a bit with us what's going on behind the scenes, and why do some developments take so much time?
What's going on behind the scenes? It's not that easy to change a process, especially in an organization which we are accustomed to do certain procedures certain way, and also deliver certain services certain way. That is one. So you have the internal part that you have to organize, but also what you have is the external, because sometimes once we come with these facilities for the clients also accustomed to get the service how they used to get it, and then you get in a situation where you are in a hybrid, that you have to give both services. And what happens is a lot of times the delivery of services will suffer, because our staff don't know exactly what to do. Some people we have to handle this way, other people we have to handle that way, etc., etc. So it's a process actually, and we think in the future we're going to tackle it a little bit different by coming with more communication internally by us and also by the client externally, so they know exactly what to expect, what are the benefits also on their behalf. So we're not doing it just for benefiting SZV, but also mostly benefiting the client, ultimately.
Just now you mentioned something about the COVID situation right now, and going back to the question about what internal project, it is not one particular project. COVID had made us become more creative in how we have to do things. I'll use an example, the medical control. It was everyone, for years I've been hearing people say, why do I have to come to SZV to sit for so long to see the doctor?
Yeah, basically, yeah.
Now, with the COVID situation, we really want you to come here. So what happens now? We find a way that we can do it online. You submit your information, your report online. The doctor will call you. And right now, it's not, in my opinion, it's not really, we haven't reached to the point where I would like it to be. We are working on adjusting it and improving the system because, but maybe when we're talking about, when we start deliberating about the future projects, we could talk about it. But this, not only for the department that falls on operations, but customer care, finance, we had to do so many things, and it was a concerted effort for all of us to do this thing, because at the end of the day, you know what's important? Everyone expects to get service. Whatever, hurricane, COVID, earthquake, whatever comes, people expect that Social Security expect SZV to keep on giving service. And that is what you see, the resiliency of our staff and management to always, no matter what, put our clients up front so that we can continue giving the service that we have to give. So that is something that when I think about it, now that I'm talking about it, it makes me very proud to be part of this SZV and be part of this big family that's taking care of the community.
Our speed, I come back to on the topic of delivery times, meeting expectations.
Yes.
I find it personally a continuous challenge. We are improving our services, we are deploying new services, but we haven't reached that point as yet where we can fully say, yes, this is what our customer wants at this moment. Because when you are developing and when you are introducing new services, you can cater to the majority of your clients, but there's always a group that is not satisfied at this moment or has a more complicated matter to deal with. And for me, my personal stride is to also include those in our service delivery. So I find it challenging to meet all expectations, and at the same time, it's also keeping me on my toes, and it's keeping me vigilant that we cannot drop the ball. So it's a balancing act. It's a balancing act. Yeah.
Yes. If I might expand on it, Parveen, I think one of the aspects we do doing Social Security insurances, and what we're dealing is with laws. And once we're dealing with law, the way that it's something is defined in the law, it's not easy to translate that in layman's terms. So basically, that's one of the most difficult aspects of it. And sometimes the clients also don't understand that, just like an insurance company, person A has a different policy from person B, right? So somebody comes to SZV, they say, oh, I got this from SZV. But if you don't know under which fund they fall under, the policies or what is applicable to that person is not applicable to you. And sometimes the clients, they get confused that why do you get something while I don't get it? But it could be related to the fund you're under, and also not everyone has the same, let's say, medical condition. Why a particular item was given to a particular individual, why a person B didn't get the item. So those are the things that sometimes it's difficult to communicate to the client, and it makes our operations also more complex. And that complexity sometimes also takes a lot of time to program into automation, by which, the speed that we would like to give the services, it's delayed.
And not only with automation, it creates like complications for regular processing.
Yes.
Even in the time that we were not so advanced with automation.
Yes.
Those are indeed the points where it's where it's getting a little bit tight, and you cannot easily convert it in a standard process, because there's so many different laws, regulations, exceptions, and I know Willemsberg that you also have that in your area. Yeah.
There's almost every day there's some exceptional case that you have to deal with, and you can't set up a system to deal with exceptions. So there always remain things that you have to deal with separately. I believe one of the biggest, it's important because although we've given through the years compared to in the past, we are given more information. We have a website that have a lot of information. But be it that people don't read, or people don't know, or they don't know where to find information, I think the expectation that people have a lot of times supersedes what we can offer, or what is offered legally, and or what the people have rights to. Like Elton said, it's based on what coverage you have, what kind of fund. And I think that is one of the things that we are challenged with, and that the people, we need to work on that part. And like I said, we need to be able to give more timely information continuously. And I think I'm thinking of the time that where people could just, as we keep on automating, that people can automatically, when they call, we have in the system, you see the number come up, you could talk to them.
Yeah.
And
already
tell them,
identify
hey,
the caller.
Yes, good afternoon, Miss Boertje. How are you? So that already gives the person, a certain personal touch that you're talking to them, and you call them by their name, because you see before they even say who they are. And then everything is at one click away. You check the information. That is one thing. But better yet would be when they could get all that information right there and there on their phone or on the computer without intervention. And I think that would be something that people consistently keep on watching this. We need more information. We need more timely information. We want to be on top of things. And we live in a general situation, an era where they said everything has to be up to date by the minute. We ain't there yet, but I believe compared to, and I'm proud to say that SZV has proven that we have a lot of information, we have a lot of data, and and we can see that when we deal with after IRMA with the World Bank, that when they ask information, we had the information there, we could give them. When IMF come, we had that information. And you know something that really I enjoy once we introduce them, and people don't see that because it's something that we working internally. Dashboards. When you can give information like that.
Yeah.
I remember when every time the Parliament used to have budget meetings and parliamentarians start asking questions, you had to be scrambling and crunching numbers to figure out, okay, this information, how much people are abroad right now? Okay, let's check in a bunch of different folders to see. Right now, I said, oh, that's the question. How much people are abroad? You want to know where they are? You know, how long they stay out there?
Yeah.
You click, here it is.
Yeah.
And I think that's those kind of things is when you could show people that, hey, we try to be proactive on certain things, that we can give information that they need. And I must say, a lot of people walk around, we tend a lot of times to think about, there's a lot of complaints, but there's a lot of people out there, the silent majority, that are very appreciative of the service, the improvement in service that we have seen SZV through the last 10 years. And I think we don't have to lose that out of sight. So it's not we ourselves might be beaten up on ourselves that hey, we ain't reached there yet, but in comparison, a lot of people are very appreciative of what is being offered right now. Of course, it's improvement, always improvement of course.
I wanted to come back to what you said about the dashboards, because that's a really good point. You said the dashboard is great for internal use, but especially Elton really worked also to make the dashboards available to our external stakeholders. So I think the function of SZV is also developing over time.
Yes.
That yes, we do that, we execute social and health insurances, but more and more we are also a supplier of very relevant information, data and information to different parties.
Yes, exactly. That's correct, Parveen. One of the power goals is also in employees portal, for instance, to work with the dashboards that employers can see their employees' amount of sick days, etc., so they have extra data and so forth, and they can verify one time, okay, this is the amount that SZV, would owe us in the case that, we have to pay loss of wages. So all of these dashboard technology also want to apply in the future for the insured. The insured will see via the dashboard what are my expenses in a particular year on healthcare providers, etc., and also break down how much in the GPs, how much we pay on medical specialism, hospital, medical referral abroad, paramedical, etc. So these dashboards, we're implementing it right now internally, but with the technology we have, that same technology, we can also show the clients those information on the portal, in the near future. So yes.
Let me start with what I think. As we stated already, the changes, what I foresee that what I have envisioned with regards to the sick leave, that 2021, that we could see that persons can report from the first day, report that they're sick in the system on our portal, that the employers could do it on the behalf, the employee themselves could do it, report sick, that we do everything online, and that the employee could see one time what has been approved, what has not been approved, when they could expect the payment. Because one of the things that all employers don't know when I'm going to get my loss of wages. So to have that I foresee. I'm seeing a project that which very soon is going to be online, is what we call our new pension registration system, what we call Lifetime. That once that goes live, that our pensioners will be able to get monthly pay slips. Of course, you have to give us an email, and that the ones every month they will get the email sent to them with a pay slip, so they don't have to come here to request or send an email to request the information to wait for us to get an answer. No, it's going to be automatic. At the end of the year, you will be getting your statement, so you could bring so you could apply for your, when you're doing your tax return. And I could go on, because we have a list of things that we are working on that we want to do. We want to have Elton could talk, because that is a project that he has been leading for quite a while, is the e-health for SZV, where doctors, pharmacies, hospital, lab, that everything is going to be connected, that makes the service faster for our clients, that and also safer.
Yes.
Maybe you can
elaborate a
little bit on that.
Yes. In 2014, 2015, SZV started to embark on e-health, which is trying to automate the whole healthcare sector within St. Maarten, by which we implement already by all the pharmacies a new pharmacy system. The new pharmacy system has what you call in Dutch medicatiebewaking, which means that it can look at counter medication. So if you have certain medication from a specialist and you get certain medication from your GP. They don't know which medication you have, but the pharmacies know exactly, and the system will tell you, oh, these two don't go together, and if you take them, you're going to have health complications. The same thing if you are allergic to something, it will tell you one time, okay, if you're allergic, this medication you cannot take, etc., etc. So that's one of the aspects. We're busy also with the GPs. In the GPs system, which we implement already by 3 GP office practices, that's going to be linked also with what we call the pharmacy system, and you're going to get electronic prescription. So you don't have a piece of paper from the doctor anymore. It goes electronically from the GP to whichever pharmacy, and you can go and pick your medication based on your SZV number. That is also one aspect. The other one is that the lab will be automatically linked with the GP system, and we tested that already, and the lab can send the results digitally from their system to the GP system. That will enhance, of course, your electronic record, and based on that electronic record, the GP system has intelligence by which it can see your diagnosis, and based on your diagnosis, it can even alert the GP and say, hey, you know what, this particular person needs to do this and this testing. There might be a risk factor for this and this disease. So that's also a very fantastic part of the whole e-health, that our clients will for surely benefit of a higher quality of healthcare on the island, and it will avoid, not 100%, but decrease malpractice, in the sense that, or somebody make a mistake, the system is there to catch up and say, hey, no, this medication doesn't go with this particular disease, right? That is one. The next one is, these systems supposed to be electronically also connected to us by SZV, and once that is done, also the client going from the healthcare provider to SZV to get a stamp of approval, then go to the healthcare provider, that will be also part of history. So all these benefits are part of it, and I think in the GP system, what I saw also is that in the near future, they will be also be able to give the patient a portal by which they can go there and also see the medical record. So it's
revealing all kind of new
yes.
new features here.
Yes, that's coming in the near future from the GP system. So it's a very ambitious, and even our people that we collaborate with also tell us, hey, once we do this on St. Maarten, we will be one of the few countries in the world that has a system that's really linked all healthcare providers to each other, which is essential to give a better healthcare. Yes. Yeah,
I had some time to think about the question while you were talking, and for me, the question is, what can people expect in the near future from SZV? And I have two main expectations that I wanted to share. The first one is, people can expect that we treat their information with confidentiality and we keep it safe. We can spend a whole another recording about what we all do about safety and cybersecurity, but that plays a very, very important role in our way forward. And the second expectation is that that the information that we have about a client or an employer or a healthcare provider is accurate and reliable, because that is the basis for all the other developments, be it a portal, be it the links with the healthcare providers, being apps or website. The data needs to be accurate, readily available and reliable. And in our administration, those are points that will become more and more important. I mean, they were always important, but now we cannot make a mistake anymore. It has to be like correct in one shot. Yes. So I think those are for me like the two main expectations that the general public can have from us.
you.